Oftentimes we'll have family members that have other family members that have a history of colorectal cancer. And so we think about that as increasing someone's risk of developing colorectal cancer themselves. There are certain inherited colorectal cancer syndromes that put people at substantially increased risk of developing colorectal cancer. Those are luckily relatively rare. They probably account for no more than about 5% of all the colorectal cancers that we see. Many of those conditions are ones that are represented by developing multiple polyps. So we kind of divide the inherited syndromes for colorectal cancer into those that develop multiple polyps. And those put folks at increased risk of developing cancer. And then there are some syndromes where folks will develop a polyp and that polyp will turn into a cancer so rapidly that we may not even actually see the polyp develop at the time. So different groupings of those syndromes. There are some other rare conditions that we'll also see that can be inherited. One that's not as rare is inflammatory bowel disease. So Crohn's disease, ulcerative colitis, can sometimes be associated or run in families, and there are probably genetic associations with those conditions. For folks who don't have those increased risks, the standard recommendation now is, it used to be age 50, but that's actually moved up now very recently to age 45. So the recommendation for the majority of the population is to get their initial colorectal cancer screening, whether that's colonoscopy or getting the stool tested for cancer DNA or other stool tests to look for blood. Those can be done through someone's primary care provider, but those are all recommended to start now at age 45. But as you asked, those who have a known family history that's strong, or those who have a known inherited colorectal cancer syndrome, those recommendations are to start much earlier for many of those patients. So some of them, so I mentioned conditions where patients have multiple polyps across their colon. Some of those screening recommendations may start even in the early teens for children that may be at risk for developing that. But most of the time it's at least 10 years before the youngest family member in the family got colorectal cancer who had that syndrome.